Pancreatic cancer, often dubbed the silent killer, doesn't shout, it whispers. And that's exactly why it's so dangerous. It hides behind symptoms that mimic everyday discomforts, a bit of indigestion, fatigue, maybe some unexplained weight loss. These are the things we brush off. We tell ourselves it's just getting old or maybe something we ate. But sometimes it's not. By the time pancreatic cancer is found, it's often advanced because the early symptoms were too subtle, too easy to ignore. That's why today's video is so important. We're going to uncover 5 early warning signs of pancreatic cancer that you should never dismiss. They may surprise you, they may shock you, but they could save your life or the life of someone you love. Let's begin. Symptom 1. Unexplained weight loss. You're not dieting. You haven't started exercising, yet the pounds are dropping off. At first you think, well, that's nice, but then your clothes feel loose, your face looks thinner in the mirror, and people start commenting. That's when the concern kicks in. Unintentional weight loss is one of the most common early signs of pancreatic cancer. This happens because the pancreas, which helps digest food and absorb nutrients, isn't functioning properly. Without those enzymes, the body can't absorb the fuel it needs, and you start losing weight fast. Sometimes this weight loss is accompanied by a loss of appetite. You feel full quickly. You just don't feel like eating, even when you used to enjoy your meals. You might even notice greasy or floating stools, signs that fat isn't being digested properly. If this is happening to you and there's no clear explanation, it's time to investigate. Especially if you're over 50. Weight loss that feels like a mystery should always raise a red flag. Symptom 2. Abdominal pain that wraps around to the back. This symptom is tricky. It can be confused with everything from pulled muscles to indigestion or even arthritis. But in pancreatic cancer, the pain is specific. It often starts in the upper abdomen and radiates around to the back like a belt tightening around your torso. It's a deep, dull ache, not sharp or stabbing. It may come and go or worsen after eating or lying down. This happens because tumors in the pancreas can press against surrounding organs or nerves, creating referred pain in areas like the lower back. Unfortunately, this is one of the most commonly overlooked signs. Many people assume it's just a part of aging or back strain. They take painkillers, apply heating pads, and move on. But if you have ongoing abdominal or back pain that doesn't resolve or seems to have no explanation, don't ignore it, especially when paired with other symptoms on this list. Symptom 3. Yellowing of the skin or eyes, jaundice. One of the most visible and alarming signs of pancreatic cancer is jaundice, when your skin and the whites of your eyes take on a yellowish hue. It happens because pancreatic tumors can block the bile duct, causing bile to build up in the liver and seep into the bloodstream. This symptom can appear before any pain or digestive issues, making it an important early warning sign. Along with the yellowing, you might notice dark urine, pale or clay-colored stools, and itchy skin. These symptoms often come together and can be very telling. If you or someone you know suddenly develops yellowing skin or eyes, don't delay. It's not something that should wait for a routine appointment. Seek medical attention promptly. It could mean the difference between catching cancer early or too late. Symptom 4. New onset diabetes or blood sugar problems. Did you know the pancreas is directly responsible for insulin production? That means any disruption to its function can mess with your blood sugar levels. For some, sudden onset diabetes, especially after age 50, is one of the earliest clues to pancreatic cancer. You may not experience typical diabetes symptoms, just slight changes like increased thirst, blurry vision, or fatigue. But if you've never had blood sugar issues and suddenly develop prediabetes or full-blown diabetes, it warrants a deeper look, especially if you're also losing weight or feeling pain. Doctors are increasingly recognizing this link. If you've recently been diagnosed with diabetes, but you're also losing weight or experiencing abdominal discomfort, ask your doctor if further testing of the pancreas is appropriate. Symptom 5. Fatigue that feels bone deep. Fatigue is a common complaint among older adults, but the fatigue linked to pancreatic cancer is different. It's persistent, debilitating, and doesn't improve with rest. People describe it as a heavy, overwhelming tiredness that seeps into the bones. It affects your ability to do even small tasks. Cooking, walking, even speaking may feel like a chore. This type of fatigue may come with anemia or nutritional deficiencies, since the pancreas helps digest nutrients. And if cancer is silently growing, your immune system is quietly fighting a war, consuming energy behind the scenes. If you're feeling constantly exhausted, especially if it comes with weight loss, pain, or jaundice, listen to your body. Chronic, unexplained fatigue is your internal alarm bell. Don't ignore it. Final thoughts. Don't dismiss the subtle signs. Pancreatic cancer is one of the most feared cancers, not because it's untreatable, but because it's often discovered too late. The early signs are so subtle, so easy to mistake for everyday issues, that many people miss them entirely. By the time the diagnosis comes, it's often already advanced. But knowledge changes that. Awareness can tip the odds in your favor. If you or someone you love is experiencing any of these symptoms, unexplained weight loss, abdominal or back pain, jaundice, new onset diabetes, or persistent fatigue, don't wait. Advocate for yourself. Push for answers. Get tested. You may just save a life.